Good evening, and welcome once again to another episode of Mind Matters. I'm Dr. Ryan Thompson. I'm the Medical Director of Mind Matters, and with me this evening is Dr. David Simon, Clinical Psychologist and our Clinical Director. And this evening we'll be doing basically part 2 of managing problem behaviors. So the premise of this is that a lot of the individuals that we see, children and the parents, oftentimes see behaviors in their children they have concerns with. They don't know how to manage, they don't know what to do with them. And it's particularly interesting in children that we see because we see primarily kids with autism, ADHD, and learning disabilities. So the behaviors which you may see in ordinary children may be different in children with these kind of things. Add to that, there's a lot of the kids with ADHD or autism or learning disabilities also have what are called comorbid diagnoses, which means they also have something else going on, which could be depression or anxiety or something called oppositional defiant disorder, which we talked about in the first episode. But these things all can change the flavor and the way that kids act and react when you're trying to parent them. So what we'd like to go through tonight is basically some more examples of areas of concern that we see with parents and with their children, both in at home and in the community and in the school, and see how we might address their concerns differently, or suggestions we might have that would make things turn out better for parents and their children. So one of the things I always like to talk to parents about is when they're seeing their child, if they've come to Mind Matters or somewhere else, and they've arrived at a diagnosis of having ADHD, which is attention deficit hyperactivity disorder, or one of the other diagnoses that we've talked about, is to try to see their child different. I talk about putting the lens of having ADHD. I guess I could do it this way. It's kind of cool looking. If they have ADHD, you have to see them a bit differently. And so you have to approach their behaviors a little bit differently, allowing for, as we talked about in the last episode, allowing for a bit of grace, understanding that some of their behaviors are not intentional. They're not just trying to get your goat, but some of these things they really do struggle with. And so trying to appreciate that as you parent them. Most parents are going to make mistakes, so they're going to mess it up. At times they're going to forget completely that their child has ADHD, and they may respond inappropriately. But what they can do if they become educated and knowledgeable about ADHD or the other diagnoses, at least when they make the mistake, they can wind back and then say, okay, I need to see my child through this lens that says they're different than the other child. So one thing that I oftentimes hear about from parents is that getting ready for school is a nightmare. It's really difficult with children with ADHD. It just ends up creating a lot of stress, a lot of conflict, and oftentimes getting out the door kind of late. And since it's a daily sort of a thing, what I'm hoping to find out from Dr. Simons tonight, because I'm sure he has all the answers, is how is it that you address that kind of concern with a parent?
Well, thank you. In terms of getting a child up and going to school, it really depends upon if we're dealing with a child that doesn't have any kind of issues or a child that does. Parents need to pick their battles very, very carefully. We can't fight on all fronts. We can't fight to get dressed. We can't fight to come down to the table. We can't fight to brush your teeth, comb your hair. We can't fight to get your books. We can't fight to get them in the car. And we can't fight on and on and on. Pick your battles carefully. Again, the age of the child. If the child is very young, then they're not expected at the age of 5 or 6 to complete and comply all those tasks. And is it because they're just unable to do it, they forget, they're distractible, or are they willfully looking at you and say, I'm not doing it? That distinction has to be made in terms of how we're going to respond. When they're older, we can take advantage of social pressure in that if the child gets up in the morning, with my child who's ADHD, we had the same issues, and if he didn't want to eat breakfast, we'd put everything in a plastic bag, and let him take it on the bus. Sometimes he would eat it, sometimes he would, but we couldn't argue on all fronts. So it really is a question of where in the process do you want to get involved. If he doesn't want to get dressed, well, you have an option of throwing his clothes in a bag and putting him on the bus. A lot of parents cannot do this. The social pressures are there, and they just won't allow themselves to do this. So there's lots of different ways to deal with it. It has to do with your expectations of what you expect of your child, the child's ability, can he cope with your expectations, and we deal with one thing at a time, not everything together. I hope that answered your question.
Not completely.
Okay.
So is there any kind of a method that you can anticipate? So if this happens every day, and you know that it's going to happen, is there something a parent can anticipate perhaps the night before, or something they can do on a daily basis which makes it easier for the child to comply?
Yeah, we can certainly sit down with the child beforehand in the evening, say, tomorrow morning we're going to get up at this time, then we're going to get dressed, then we're going to brush our teeth, then we're going to eat, then we're going to pack and lunch, and we're going to go to school. And they know the sequence, because oftentimes the assumption that we have is that the child understands what's expected of them, and they just won't do it. And oftentimes, if you have a child with an attention deficit disorder, they're not going to know that. They're going to get distractible. They're going to get dressed, and you'll find them playing with the toys in their room. So what we do is we structure the morning, and we have one segment at a time. And if we need to complete one segment, then go and talk to the child to the next one. Then that's what we'll have to do.
And I echo that. As part of that, as I understand that, if a child does have a tendency to be distracted, if they drift away from what they're supposed to be doing, and you remind them what they should be doing, if it's something that's familiar, something they've done before, it always comes in the same sequence, it's much easier for them to go back to say, oh yeah, that's right, I'm supposed to be doing this because that's what we always do. We always do it in that sequence. So it's not like learning new information for them if they go back to that same sort of routine. I think you also mentioned before about, is there something to do the night before that's going to make the daytime process easier? What can a parent do the night before?
Well, consistency is really the issue with a lot of children, and especially children who have ADHD. Consistency and following through an organization. So we need to be very consistent and not vary from the sequence of events. We can sit and talk to the child and let them specifically know, we're going to get up in the morning, and here's what we're going to do. You can lay out the clothes as the next step, and you can wait 5 minutes and check, and if he's playing, then you have to remind him it's time to come down and eat, and one step at a time. You're not going to be able to deal with all the sequence moves at the same time. Certainly the parent has real issues to deal with. They might have to get up and hurry up and go to work, but to hurry up a child who's disorganized and to become emotionally involved, it's going to create a real disaster in the morning, and the day's not going to start off very well for both the parent and the child.
And then jump right in, probably in the most common concern parents have, especially related to school, as I call it, the King Kong of difficulties, is the homework problem, the homework monster, is that we frequently see that's a battle. It absorbs family time, energy, and it's a nightly thing that both child and parent end up being exhausted.
Right.
So how do we help them contend with that?
Well, I can't emphasize enough that routines in a family are very, very important, because then the child knows what to expect. So again, it depends on the child. Is he bored with the subject? He doesn't like it. He doesn't want to spend the time. If we know that we're going to have a homework time after supper, then depending on the kind of child we have, if he's the kind of child that can sustain his attention, then we will allow him that hour to do it. If it's too much, we'll break it into segments. If he has 20 problems to do for math, we'll let him do 3 problems, and we'll let him play for 5 or 6 minutes, and then he'll come back, do 3 more. We chunk it so they're success-oriented tasks, and therefore the child's expectation of failure is not apparent, and the parent will feel like they're moving forward slowly. Unfortunately, parents don't have the patience sometimes and say to themselves, well, he can do 3 of them, so why can't he do 20? Again, that's the parent's issue, and we need to pay attention to what the child is capable of doing.
Okay. One of the frequent questions that parents ask as soon as a child comes home, do you have any homework? And they don't always get an honest reply. How come?
I'm sorry, are you saying that the child will say, no, I don't?
Right.
Well, again, and I can't emphasize this enough, we need to be able to be in touch with the school to find out what is coming home every day. Now, either we can get a weekly lesson plan or not, so that we understand what has to be done. Because if we just listen to the child, he will say whatever he wants to say, and we'll argue with him, well, gee, this doesn't make any sense. You're supposed to have homework every day, and you're saying you don't. To avoid that, we have constant contact with the teacher to find out exactly what is due and when it's due. And the further they progress in school, the more consistent that will be. The more consistent it will be in terms of what has to be done. And they get class schedules and class assignments.
And to add to that, I think sometimes what I see in kids who have ADHD, and you ask them do you have homework question, normally they don't want to do homework. It's already been something that's, it's a very disagreeable thing to do.
Yep.
And oftentimes they just answer automatically. They'll just say no without ever even considered whether or not they actually have homework. So sometimes one of the things I coach parents is to say, not do you have homework, it's why don't you get out your homework and let's see what you need to do.
Right.
Because that doesn't give them the opportunity to say, I know I don't have it. Because then you get into the cycle of you're lying to me, and then I think as you said in the prior episode, then you end up arguing about what's between you and him instead of in dealing with what's really important, which would be the homework part. The other thing is oftentimes see is once a child sits down to do homework, or you say, okay, it's time for homework, they don't initiate it, they don't get started. Once they get started, they have trouble staying on it. How do we help them?
Okay. Well, let's take the first part of that question. Sometimes the child will sit down and they'll want to do the homework, and we can either ask them why they don't want it. Well, it's too hard. Let's say he's doing a math problem. So what the mother will do or the father will do, or they'll dive right in and do the problem, but we don't really know what the issue is. So I always think about, when I ask children about their homework, I think about an onion, that we peel the onion slowly. What is it about the homework you can't do? Well, I can't do this problem. What is it about the problem? I can't do page number 5, or I can't do the math. Next layer, what about the math? Until we finally ask the question, we get to it, and he might say, I don't know what this sign means. In other words, we want to intervene at the child's level where it becomes difficult for him. Because if not, we're going to solve the problem for him, and we deprive the child of figuring out most of it by himself. And parents do that, and I can't say I didn't do that with my kids. We jump in and we do it, and expecting the child to learn by watching, and somehow he'll just absorb it. And the best way to do that is you peel away what he knows, and you'll find out the fact that maybe there's just a small piece of the puzzle he can't do. And then we show him what the piece is, and then he'll put the whole thing together, hopefully.
That sounds great, actually. I like the idea of you're trying to help your child to problem solve, which is not always their forte. And I can also appreciate as a parent being impatient, tired of the homework thing. I just want to get it done because I want to get to do what I wanted to do. And if I just do it for the child, then it's done and I can go on and do what I want. So my impatience and my want to do something else, I'm sure, can influence how well I do that, where I see it as an opportunity for the child to learn how to problem solve. I think that's a great idea.
Well, it is.
The other thing I think sometimes is, since homework takes forever sometimes, and most parents are going to get frustrated, and again, I know you've addressed it a little bit as far as breaking it into pieces, is there anything else they can do? If it takes 2 or 3 hours of homework at night, is there anything you might advise the parents to do?
Well, if it's 3 hours a night and it's a 20-minute assignment, then it really has less to do with the homework than it has to do with the interaction between the parent and the child. My question would be, how is it that he'll get to fight for 3 hours about doing his homework, and something should happen within 20 minutes if he's starting? And again, and I go back to this all the time, there needs always to be an antecedent to the behavior, and there needs to be a consequence. So we have to leave it up to the child, and we have to make a consequence something that he really doesn't want to happen, and he decides that it's easier to do the homework than to lose something that he really likes.
Okay. And the other thing I guess I would add to that is sometimes if a child has medication and the medication's worn off by the time evening rolls around,
right,
and if it's an ongoing problem that it's not fair to ask the child to stay on task for a long period of time, maybe it really is too much homework. And so then the question is it unfair to ask the child to do something that he's really not capable of doing? And then how would you address that? Well,
there's 2 answers to that. Yes, it is unfair, but I think primarily if it was a medication issue, I'd refer back to the either family practitioner, such as Dr. Thompson, or the family's physician, if it isn't Dr. Thompson, to talk about medications, because certainly if a child's able to attend for a certain amount of time and then stops, and once we know it stops, it's really a very difficult situation. We can't blame the child for not doing it. And then again, we would want to talk to the family physician to see if there are medications or alternative medications or alternative things that he can use to help sustain his attention. And that's a medical issue. It needs to be addressed first.
And I would add that also then, if, say, that option doesn't exist or it can't happen, is being able to advise the parent to go back to the teacher and go back to the educational team.
Right.
If the child does have a 504, which is an accommodation plan
Right.
at school, that could be modified to say it's not a realistic expectation that this child get this volume of homework and then be expected to do it after the medication's gone or at a time of night. So sometimes reducing the amount of homework is something that can be helpful. Where an example oftentimes is given where if you've given 20 math problems, like you used the example, a child with ADHD may have trouble accomplishing all 20, but if you tell them, I just want you to do the odd problems, not the even problems,
Right.
so that's going to reduce the repetition. They'll still understand the concept. Part of the idea of what homework accomplishes is understanding the concept, and through repetition, you understand it better. Yet limiting that to a child so you don't get to the frustration point where both parent and child are pulling your hair out. So sometimes being able to say, okay, this just isn't working. Whatever we're doing
Right.
isn't working. So going back to the educational team and say,
Right.
okay, we can't do this. It's not, because I'm very protective of a family too, because a family time is critical. I mean, you want to be enjoying your child, and not just this child. What if the child with ADHD is absorbing 2 hours of your time and he has 2 siblings? And then how's that going to affect the whole family dynamic, and how do we protect that? So I think that's part of being able to go back and say, okay, if it's not working, what do we do? Can we change that?
Well, I think you're exactly right. If we know from experience that 6 or 7 o'clock, whatever reason the medication wears off, and we know there's an impending disaster, I don't know why a parent would run towards that disaster. I would agree with you that it's very possible that we can make arrangements with the school, that he can spend a half hour after school to do all his homework in the classroom with the teacher, and it'll probably be done correctly, and it'll only be a half an hour.
And a lot of medications do wear off.
Right.
You know, they're supposed to wear off before bedtime because they can interfere with sleep. So it's, intentionally you're not supposed to be having the medication be active as
Right.
it gets close to bedtime.
So let me ask you a question, doctor. From a medical standpoint, when the parent comes to you and says, he's just wonderful till about 4 or 5 in the afternoon, but is there anything you can give my child, or anything we can do? Is there any more medication we can give him so that we can have 3 or 4 more hours of a very compliant child? How do you deal with that?
Sometimes it's a matter of adding another medication towards the end of the day, but sometimes that can interfere with sleep, especially if a child their bedtime is between 7 or 8, especially a younger child. That can start to interfere with that. So sometimes you have to say, well, we need to restructure when the child does the homework. Maybe we have to do it before 5 o'clock. So maybe it really has to be right after school. Maybe you can restructure things at school. I know have some kids who do study skills class or study hall or tutoring right after school. And children with ADHD oftentimes can accomplish that then while medication is still effective, while they still have the structure. And frankly, sometimes a tutor does better than a parent when it comes to enforcing or encouraging a child to complete the homework.
Okay, well, as you were speaking, something came to mind, so let me ask you another question. I understand, as a non-medical person, that there are short-acting and long-acting medications. Is that correct?
Yes.
So is it then possible for a child to have a short-acting medication when he wakes up, and we know that it's going to last, say, till 1 o'clock? Would it be then advisable to wait until 3 o'clock to give him another short-acting medication so that by the time 8 o'clock is there, 8:30, the medication has kind of worn off, as we would say? Is that a possibility?
It's a possibility. Sometimes that works and sometimes doesn't work very well. Especially the shorter acting medications, sometimes their onset and their offset can be pretty disruptive to a child. So for some kids that works. Some kids it doesn't work so well, especially if it tends to linger on into the nighttime hours. So sometimes I'll have parents have that available for certain nights, but on a nightly basis, it doesn't always work.
I know that when I talk to parents, when you mention medication, they immediately think of drugs. And there's certainly not a very positive connotation to that word. How do you deal with parents when they come and say to you, I don't want to drug my child?
That's a big question.
Yeah, it is. It's an important one, too.
Right. So basically, like with any treatment, you have to say what's the potential benefit, what's the potential risk, and then basically what are the potential risks of treating and not treating. So there's a potential risk in not treating. The child continues to fail or flail in school, does poorly, has poor self-esteem, drops out of school, has a lot of negative behavior as a result. So that is a potential negative outcome of not treating. And a potential risk of treating is the side effects of the medication. Is there any long-term risk or consequence of that? And that's going to depend on the medication. So no parent in the right mind would want to put their child on medication. That would be a crazy parent. So a parent has to understand that the condition is significant enough to warrant taking medication, just like any other medical condition. You don't treat people with high blood pressure medication if they don't have high blood pressure. So it has to be significant enough to want to treat it. So that would be an area where you have to kind of, most parents have misgivings about that. And if you haven't tried other things first, then that would be foolish. So almost any parent, they would have already tried many things before they arrived at the point of deciding whether or not medication would be warranted.
Do you have many parents who are concerned about side effects and long-lasting effects of medication? How do you address that with a parent who's really not really in favor of medication, but based upon your diagnostic beliefs, feel like it would be the best thing to do? How do you alleviate those kind of concerns?
Mostly through experience and mostly through the evidence that's out there. So you can reassure a parent that most all the medications you're using have been tried and used long term. And yes, I alert them to what the potential side effects and risks are. The good, the bad, what's happening when it's working, what happens when it's not working, is there any kind of risk as far as down the road, what's a long-term risk? I do a full description of that with the parents so they really understand what they're getting into. I
often have parents who bring up that situation in terms of medication. I'm not a physician, so I certainly don't get involved in the kind of medication they should have, but some of them have had bad experiences in their life with medication. And I usually talk to them about, is it your own fear and concern due to your own experience that you don't want to use medication to your child? Because that's really important. Are you putting your needs first, that your own issues and concerns about it, or are you putting the child's needs first? And that can be a big issue that I work with parents about. And it needs to be understood. Are they acting because it makes them feel better not to know that the child is on medication, which then brings me to the thought that maybe they're just having difficulty accepting the fact that their child does have a disability. And that's really difficult for parents to accept sometimes.
And there's also what I find is the children who they are taking medication, developmentally, almost invariably, a child at some point will not want to take supplements or vitamins or their medication, and they'll start squirreling it away, putting it in their cheek, that sort of a thing. And that's sometimes hard to address. Is that something you advise for parents about?
Well, I addressed it personally with my own son who had severe ADHD. He was very hyperactive and impulsive, and he reached a point when he was 17 or 18 and he said, I'm not taking medication anymore. And there's really nothing a parent can do. That has to do with a lot of issues. One is that it's a time of independence and moving away from your parent and finding your way in life. And unfortunately, we have a great deal of experience in life, and sometimes the children aren't really interested. I remember a senior psychiatrist, a training psychiatrist, talked to me once, and he told me about children. You lay before them everything that you've learned in life that's valuable, and you so thankfully pick up one of the skills, because we know that if they don't, this is going to happen in their life, but that's something they just have to experience. And so once they reach a certain age, as sad as it is, they might make decisions that we don't agree with, and we know it's going to cause trouble, but we're done parenting in a direct way at that time.
So oftentimes what parents describe in their children with ADHD, once they after they've gone through the educational system, if they're not terribly successful, pretty soon they're just not trying, and they really aren't. They give up, they stop trying. How do you counsel a parent at that point?
I get very concerned about that issue. And the reason is that we can't have a child from first, second, third grade on attend a situation every day where they fail, where they measure up, unfortunately, not how they think compared to other children their age. And it's one continual cycle, and we can only confront that failure for so many years, and it affects us personally. You worry about depression, you worry about anxiety, and you worry very much about self-esteem, because that's going to affect his motivation, and these three factors will dictate the course of his life. Then one begins to wonder how it's being dealt with. Are the parents saying, well, you know, your cousin can do it, why can't you? Or dad could do it, why can't you? It's not that hard, why can't you? It's very unfair, because my sense is that if a child could do it, he would. And again, and I go back to this so often, this is a behavior that occurs within the context of a family, and it needs to be dealt with as a family, and how a parent will treat their child and offer coping skills and the outcome. And a parent can do this by their own experiences. I had trouble with this, there was my coping skill, and this was the result. And that's very helpful for a child to see that a parent had some difficulty, how we dealt with it, and the outcome. And that's the best we can do with our children.
What I oftentimes talk to parents about is if you're a child and you're going through school and you get all the negative feedback that oftentimes children with ADHD, how come you're not doing it, get back to doing this. They get sent to the office, the parents are after them, the homework's not turned in, they get into the cycle of lying and denying and things like that. Pretty soon it's a matter of saying, okay, every time I go to school I feel like I'm hitting myself in the head, and you say, as a parent, when you say, I want you to keep doing that, at some point you say, the child's not foolish. The child pretty much says, why do I want to keep banging myself on the forehead? Why don't I just give up and quit? So part of it seems really logical. So part of that question is, how do you prevent that?
Whoever said parenting is logical?
Really? Good luck on that.
I've always been a firm believer in that parents are going to say something to their child which indicates they're not doing something well. But I think for every negative thing you say to a child, you need to balance it positively. You can always find a reason to tell a child how good he is and how much you love him. It's there, and we just have to pay attention to it. If we're going to say that you're not doing well in this area, then we've got to balance by saying you're doing very well in this area, and that he's not disappointing us. I always think about the child who studies and studies and studies and studies 5 hours a day for almost a month because he wants to do well on a certain test, and he doesn't do well. What happens to those 5 hours every day? He has to be congratulated. He has to be told how proud you are, that he was diligent and he was persistent and he wouldn't give up. He needs to know that it's not always the end result, but the process which really needs to be addressed.
Great. So it is a process. It is no perfect parenting strategy. And I think it's so important what you're saying is making sure we find ways to help them be successful.
Right.
Thank you very much for listening tonight.